What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
Now I have the very distinct pleasure of introducing the Assistant Secretary of Labor, Dr. David Michaels. And he has also been a very strong advocate for ADAO. And he's going to present an award to another outstanding individual who has worked with us over the years. Secretary Michaels.
Dr. Lemon, thank you. As you know, I'm presenting the award to Dr. Celeste Monforton, who couldn't be here tonight, but I understand this is being live streamed and videoed. We hope if she's not watching now, she'll be able to watch soon. So I'm really going to speak to her. And I'm sure you'll join me in sending her the greetings from this room. So Celeste, it is truly an honor to be here tonight presenting you with this award. I've had the great pleasure of working with you for more than 10 years. I still remember our first meeting. You had risen very high in the career staff at the Labor Department, starting at OSHA, and eventually as Special Assistant to the Assistant Secretary of Labor for Mine Safety and Health. But you couldn't stomach how the agencies were being run by the political appointees of the last administration, and you had to get out. Why not go back to school, you thought, and that's how I came to know you. In these subsequent years, I've known you first as a student, then as a research assistant, TA, co-author on numerous papers, faculty colleague, and now as a stakeholder and critic of OSHA, relentlessly pushing my agency and MSHA, the White House and Congress, to do a better job protecting America's workers. You are the living embodiment of speaking truth to power. With your great passion, you insist that workers should not have to face hazards that could take their limbs, or their lungs, or their lives. But if that does happen, you insist that justice be served. You insist law-breaking employers pay the price. You insist lethargic or timid agencies are taken to task. And following workplace tragedies like Sago, or Upper Big Branch, or Libby, Montana, you insist the families of victims are heard. It is very fitting that you are receiving an award named for Dr. Irving Selikoff, because in addition to being a brilliant physician-scientist, he was a fierce advocate. He didn't discover that asbestos caused lung disease or cancer or mesothelioma, but he understood how to communicate his findings to move people and institutions. In many ways, you are very much like Dr. Selikoff. You're a tireless advocate, but armed with a remarkable set of skills, expertise, and knowledge that makes your advocacy so powerful. You understand the law and the workings of our institutions, so you can lead a lobbying visit with family members who have never been to Capitol Hill, choreograph a meeting that reshapes the thinking of senior administration officials, craft powerful testimony, file a fearsome FOIA request, or feed a reporter just the right information to trigger a powerful news report. But you are also a scientist. You can dissect an epidemiology or toxicology study and show exactly why the paper is a mercenary attempt to exonerate a dangerous substance. Your doctoral dissertation was an awesome example of your intellect and perseverance. You wanted to measure the impact of a change in law on mine worker safety, so you mastered complicated time series analyses that would have been a challenge to senior epidemiologists. And not surprisingly, you're a superb teacher. Your classes at George Washington University received the highest student evaluations. And you do it all with infectious enthusiasm, a smile on your face, amazing generosity, and great modesty. When I spoke with several people with whom you've worked closely, none of them even knew you were getting this very prestigious award. Many of you here tonight know that at some union and professional meetings, members of our community create and perform impromptu skits. And we can count on Celeste to be in every skit. And Celeste, we will never forget your Sarah Palin imitation. You're known across the country as someone who will go the extra mile to help a friend or a colleague or a student. When you lived in Washington, not far from here, and there was a hearing on the Hill, you'd pick people up at the airport, you'd put them up in your guest bedroom or on your sofa so they wouldn't have to pay for a hotel. You'd host the planning sessions at your dining room table. When you taught occupational safety and health to undergraduates, you'd lead the voluntary Saturday morning stream and river cleanups and take students on tours of work sites that you'd arrange yourself. Now, you're facing your greatest challenge, and you're fighting cancer with the same force and determination you focused on law-breaking, worker-killing employers at Libby, Montana, or Sago, West Virginia. This award is a symbolic thanks from all of us who fight for better, safer workplaces. Thanks for the awesome work you've done. Thanks for the lives you've saved. And thanks for the important work we know you will keep doing long into the future. Thank you.
I don't want to start this. We have a video of Celeste. As Dr. Michael so beautifully portrayed Celeste, you get to see her for a few minutes on the screen. Celeste, you hear us? We're talking to you. She is utterly amazing and so deeply loved. So take a couple minutes, enjoy Celeste, and then we'll present the award. And she has an acceptance speech that she has sent. So we can watch this together. They're ready.
It's a real pleasure to be here at this terrific annual event, and yes, asbestos is still legal, but I would like this as my alternative title. Frankly, it frightens me when I hear people, educated people, say that they think there's a ban on asbestos, and we're the 1% that know the facts, and it's up to us to educate the other 99%, and that's why ADAO's mission is so vitally important.
You wouldn't believe the number of people who, when you tell them that asbestos is not banned, they're like, well, I'm going to go and Google it and find out. It is banned. I know it's banned. And most people, I would guess probably 99% of the population in the U.S. believes that asbestos is banned, and it's not banned. And if we can't even ban something that is a known carcinogen like asbestos, how in the world are we going to deal with other hazardous substances in our environment? And the cost to society, it's almost, it's such a huge number that you can't even calculate it, because you don't just have healthcare costs. You have people who have losing time from work because of their own illness, but the caretakers for those people, the effect on children and their families when your mother or father has a disease, lost productivity, the cost of all of the medical treatments. So the costs to society are enormous.
We need better laws to protect workers who encounter asbestos in buildings and infrastructures and soil. We need a total ban on asbestos so that no more of it is brought into our country. And we need criminal penalties for individuals and companies who violate OSHA asbestos standards. No one should have the right to poison someone and walk away.
There is only one Celeste, but I'll do my best, Celeste, to put on my knee highs, my sneakers, and pretend like I'm you at an APHA skit. Celeste sent me her remarks. I am truly honored to receive the Irving Selkoff Lifetime Achievement Award from ADAO. I'm very sorry that I cannot be there in person to accept it. She says to us, keep up the fight to identify more effective treatments for asbestos-related diseases. Keep strong for the battle for a ban on asbestos in the U.S. And lastly, keep seeking justice for those whose lives and communities have been harmed by this. Celeste. Celeste, we all love you. Please raise your hands for Celeste.